What if my patient were denied treatment for Lyme disease based on an AI algorithm? I'd like to address this topic as part of my Common Sense Lyme series, where I address questions that my patients have and issues that they face during their treatment. So let's begin. Now, AI in medicine supports care for a lot of diseases, but Lyme disease isn't so simple. It's a complex issue. There's a potential for a rigid algorithm, so I'd like to discuss that at greater length. Now, there's two guidelines that are in conflict. So if they support the ILADS guidelines, International Lyme and Associated Diseases Society guidelines, they support individualized care. They discuss chronic Lyme disease issues, co-infections. The IDSA, the Infectious Diseases Society of America, discourages retreatment. They will encourage a second month if you have Lyme arthritis that's recurrent. But if you're still sick, lately they've been discussing it as a syndrome, post-treatment Lyme disease syndrome. What guideline might AI follow? Well, what if my patient has ongoing symptoms? Let's say they have fatigue, brain fog, pain. The algorithm says post-treatment Lyme disease syndrome. No further treatment is necessary. But my patient is still sick. If I follow the algorithm, they might suffer. If I treat them, I risk being flagged. It's a question of bias in, harm out. Could the algorithm keep me from being able to practice medicine I would like? Now, Lyme disease isn't one size fits all. Of course, it's changing over time. It's only been around for about 40 years. I've been treating for over 37 years, and I keep seeing changes in the literature, changes in what I do, and changes in what my colleagues are doing. So symptoms vary, co-infections matter. AI doesn't always account for nuances. They're not at the bedside. They're not taking care of my patients. My patients need flexibility. If they're well in 30 days, great. And if they're not, I have a need to not follow an algorithm. AI is supposed to be a tool, not override clinical judgment. I should be able to override, reevaluate, and retreat. My patient can't stop at an AI screen. What my patients deserve, they need a thorough evaluation for Lyme and to rule out other conditions. I've had patients with both the traditional conditions as well as Lyme disease. They need clinical attention to their individual status, and they need a path forward, not a rigid protocol. Don't let AI decide when Lyme disease care ends. If my patient still needs help, I'm there for them. Thank you for joining me for this Common Sense Lyme series. Have a good day.